Assalamualaikum warahmatullahi ta'ala wabarakatuh.
I am Baisahida Yaman.
And I am Reynalyn Yu Makadato. And we will be going to discuss the 17th topic, which is the National Household Targeting System for Poverty Reduction.
The government of the Philippines has made significant progress in developing the social protection sector over the last decade, which has been one of the main strategies to address poverty and vulnerability of Filipinos. One that is hailed as a pivotal development has been the introduction of National Household Targeting System, popularly known as Listahanan. National Household Targeting System for Poverty Reduction is an information management system that identifies who and where the poor are. This makes available to national government agencies and other social protection stakeholders as a pioneer database consisting of a comprehensive organization of information of the poor households nationwide. The Listahanan enabled the creation of a registry of poor Filipinos across the country that was used to identify poor beneficiaries of the GOP's largest social protection programs, the Pantawid Pamilyang Pilipino Program, Conditional Cash Transfer or CCT, and PhilHealth Universal Healthcare or UHC program, and their subsequent massive expansion. The Listahanan was adopted as the government's primary mechanism for targeting poor households for social protection programs in March 2010 through Executive Order number 867 or EO 867. The significance of establishing the Listahanan and its achievements extend far beyond the country. Grounded in empirical studies, the experience of Listahanan is as a leading good practice example for a growing number of countries in East Asia and the Pacific, as well as in other regions that inspire to introduce such registries. This note documents the main features, processes, and key decision points involved in the design and continuous enhancement of the Philippine household targeting system as a contribution to the body of global knowledge on targeting systems.
So now let us proceed to the brief history of the National Household Targeting System for Poverty Reduction. Since it was first made public in 2010, many agencies and groups have used the Listahanan database to find out what the poor needs and to meet those needs. Several government agencies have used it to ensure their programs don't forget about the poor. The database was used to identify the beneficiaries of various state programs such as the Pantawid Pamilyang Pilipino Program or the 4Ps of the Department of Social Welfare and Development and the PhilHealth for Indigent of Health Insurance Corporation. Although the Listahanan database is not a financial assistance program, it does serve as a reliable record of the people who avail of various government services and programs. For instance, unlike the programs such as the Unconditional Cash Transfer programs, which provides cash grants directly to the recipients, the Listahanan database is not just used to identify the people who are receiving those benefits. So talking about benefits, what are those benefits? First, it allows local government units or the LGUs to have access to the official list of poor families as identified by the DSWD. Second, it provides a better understanding of poverty in each locality, helping the LGUs plan and implement more effective development interventions. Third, more than 5 million families have been categorized as poor. Fourth, social protection programs can be designed to address multiple dimensions of poverty. And fifth, it enhanced the impact of social protection programs and minimizing the wastage of resources. Listahanan's method of identifying the poor is different from other methods because it uses a systematic process to determine the real poverty level in our country. It does not rely on personal preferences or political influences. The 4-year operational cycle listahanan are designed to ensure that the identification of the poor is carried out with accuracy and reliability. The listahanan's 4-year operational cycle has its 4 stages. So the stage 1, preparation. It is at this initial stage of the listahanan process that the PMT models, instruments, and systems are designed and tested. This is also when data collection strategies are planned and coordinated with field offices as well as the local government units. With all these processes involved, this takes the most amount of time in the targeting process and for a good reason. Stage 2, data collection and analysis. The collection of data is done through household assessment. In conducting household assessment, all households in the identified areas were assessed through house-to-house interview using the Household Assessment Form or the HAF, a 2-page questionnaire with 39 observable and verifiable variables. All information indicated in the household assessment form are encoded to a web application and subjected to proxy means test or the PMT. Classification of households as poor or non-poor. After incomes are estimated using the PMT, the estimated income of a household is compared to the poverty threshold of the province to determine if it is poor or non-poor. Households with estimated income that fall below the poverty threshold of their province are classified as poor. A primary list of poor household is then generated, which will be subjected to validation.
Now, let us proceed to the stage number 3, which is the community validation. Validation is the process of community vetting of the listahanan's list of poor households. At this stage, the preliminary results of the PMT models were shared with the community for them to challenge or correct. Specifically, the preliminary list of poor households is posted in every municipality and barangay to get feedback on validity of poor or non-poor classification with local perception and identify inclusion or exclusions from the list, and it therefore allows for feedback, queries, and requests to be received from everyone in the barangay. All feedback are received and recorded in the complaints form. A local verification committee or LVC, which consisted of the municipal or city social welfare officer or the chair or the municipal city planning and development officer and 3 other members who represent the CSO and or NGO, was created at the municipal level to address or act to all complaints and appeals received during the validation period. The validation process is given 30 days in the community and completed nationwide in 30 days between September 2010 and January 2011. Now, let us proceed to the last stage, which is the dissemination. The dissemination involved informing the LGUs and individuals of the process surrounding the NHTSPR and providing options to apply and present complaints in the validation process. This included designing flyers and posters and using a variety of media like radio or TV to inform communities about the validation process.
So that ends our presentation. Thank you for listening.